when they did that, the blue line here shows the weight loss at 1 year was about 35 pounds of weight loss, and that's with the 80+% retention. And at 2 years, there was a 5-pound weight regain, but they still maintained a 30-pound weight loss, which is truly remarkable among non-drug assisted or surgery assisted lifestyle interventions. And then the usual care group, you can see that their weight went up over the 2-year period of time. And on the right-hand side, you can see that hemoglobin A1C dropped about 1.2 units at 1 year, and we maintained a 0.9 unit reduction. And 0.9 unit reduction is the same or more than you would expect from one full, powerful type 2 diabetes intervention drug. The other thing that occurred in the first, over this time period is we reduced and maintained the patients off more than half of their diabetes medications. And for the people who started on insulin, half of them stopped their insulin in the first month. And you heard Dr. Penny Figtree mention that, and she also, and I was delighted to hear her say that this is not an easy thing to do and to monitor, and the way that we can do this safely in a very large number of people, and we now have tens of thousands of people with whom we're doing this, is because we have the app, and they have continuous access to a trained physician and working with a trained coach. This is now a graph of the 12 different biomarkers that are associated with coronary disease risk that has been formally proposed as a way of measuring long-term disease risk, 10-year disease risk. The overall disease score is reduced by 12%. The only fly in the ointment is there in the middle, that downward pointing arrow with a red core is LDL cholesterol. And if blue goes up, it's because the ketogenic diet improved it. If blue goes down, ketogenic diet made it worse. On average, LDL went up, but the thing's pointing down there. LDL went up about 10%, 9% in this population. But the HDL cholesterol went up markedly. So pretty much everything else improved. And the result is that this calculated disease score, where we don't look at just one key on the keyboard, but we look at the whole keyboard, is getting better. Cutting to the chase, inflammation. We measured 16 biomarkers. 2 of them were not significant. The one on the right, where it goes up, which is VCAM1, is not actually a risk, is not associated with diabetes risk. And over on the left-hand side, the ICAM1 was reduced at 1 year in blue and further reduced at 2 years in red, but it wasn't statistically significant. All the other reductions were significant. If you look at the far left-hand side, the well-formulated ketogenic diet at 1 year reduced C-reactive protein by over 30%. And it wasn't significantly reduced further, but at 2 years we had an even greater reduction in CRP. But the important thing is we changed the level of inflammatory stimulus across the whole keyboard. So there was a balanced effect of this, but realize we've evolved with this molecule since the liver was invented. This is an evolutionarily long-lasting thing that through evolution the body has figured out, how do we play this music where we respond when necessary to challenges like inflammation or like infection or trauma, and then how do we shut it back down into the normal resting range when it's not doing us harm, and clearly we're doing this in a balanced manner